For this week's progress update, I discuss the increased risks when reaching week 12, then share some reflections on getting this far into the rehab process, and then provide the usual updates on exercises. Timestamps are in the description below.
Okay, so it's just after the 12-week mark for me, day 88. I saw an orthopedic surgeon yesterday, orthopedic registrar. I hadn't talked to him before, but he reviewed my case and just wanted to check that I was going okay. It was a follow-up appointment. But he asked me a few things, just how it was going, and checked out the tendon itself and said that tendon was looking really good. He asked me to do a double leg heel raise, and I did, just so we could check it out and observe the function. And then a single leg, and I said, well, that's not going to be possible. Then I saw my physiotherapist today and reviewed the progress, and funnily enough, one of the exercises I've been given is single leg heel raise attempts. So we tried it during the appointment, and I think the very first one I felt like I'd gotten up off the floor, which is new for me. I can't recall having done that or attempted it because of the extra load, but it seems to be that the tendon should be good enough to be able to take that. It's just when it gets stretched or has sort of way too much pressure applied to it that you're at risk. So I'll be doing single leg heel raises now. The other thing the orthopedic surgeon said yesterday was that the 12-week mark, or at least when the boot comes off and people start doing a lot of their normal things as before, is actually, he said, the riskiest point in time. I'm not entirely sure how we would gauge risk in this sense. Because you could track people through their progression and see where the most re-ruptures occur. But in talking to the physio today, he said, yes, but it's sort of, the tendon itself and the tissue, it's actually quite good. It's more a case of where people start feeling like they can do the things that they used to, and very often blatantly ignoring medical advice. So for now, I'm just continuing to walk, taking it easy, loading up the weight with the exercises. Then I'll progress to, single leg heel lifts and trying to get some height out of that, and then single leg hopping down the track and that kind of thing. So as long as I'm not going for runs, doing silly things, getting back into contact sports too early, should be fine. Overall, progress is good. It's slow. Been enjoying doing things that I wasn't able to do for a long time. For the past few weeks, I've been standing while showering. That's much better than having to sit down and do it. It's much quicker. Step in, step out of the shower. In general, walking around, I'm feeling more confident with stepping everywhere, even uneven ground, sort of getting myself used to bumps and cracks in the pavement, and stairs is still a bit of feels like a riskier one. If I guess the main idea is you don't want to be going up onto a step and having the heel, you can't even do it, but having the heel drop down like that on the step. And so the calf raises are all geared to be from a less risky platform. The foot should be flat against the floor, and not like those calf raise machines where the heel drops. So I confirmed with the physio today that definitely shouldn't be doing that kind of thing yet. Focusing on strengthening the calf and the tendon before we start stretching it. So I'll be reminding myself to take it easy with the heel pullback squishing. We're not really aiming to stretch there. I've been enjoying driving. It's really nice to be back to driving, and Still feels a bit tight from time to time, but all the old instincts are still there, which is good. The emergency brakes, they work, and I'm not walking away afterwards or having to hobble away afterwards. So I haven't done a lot of start-stop or long drives. That could be a bit different, but driving's back to normal, so that opens up a lot of other options. Still going to be a long way from martial arts, unfortunately, but that is what it is. And yeah, I did ask about snowboarding in January today, but that's yeah, I thought there'd be like a 5% chance it could work, but the physio said that normally we're looking at getting single leg heel raises, to, I don't know, 95% height, looking at doing running and single leg hopping before someone starts going back to normal physical activity like snowboarding in this case, or I'm guessing that'll be like martial arts as well. So yeah, it's pretty slow. I had a bit of a moment on Sunday when I hit the 3-month mark, or the 12-week mark, and I saw the note in my calendar, and it's one of those things. It's not like I really had a choice, but it's not like I had a not like I had a good alternative to progressing through the physio and doing the rehab required. And yet at the same time, at the start, it didn't really feel like it was possible, or at least I didn't know if I could do it. And to get to the 12-week mark and realize I had gotten through it, obviously that's affecting me right now, even just thinking about it. It's been really tough. It's been physically tough just to try and learn how to do things again, learn to walk again, and lift weights with the leg that you just think nothing of before. And now it's a challenge. So physically it's not easy. And obviously there are emotional periods where you're frustrated, you're angry, you feel rage, helplessness, despair. And it sucks. So I don't know how this video is going to turn out one day. I'm just recording it along the way and capturing stuff like this, my thoughts. If you're watching this and you're going through it, I guess know that you're not alone, and this, yeah, it really sucks. Maybe you're lucky and it's affecting you less than me. Hopefully it's not affecting you more. Just, I don't know, I'm guessing someone who's further down the track, let's say, what would future Scott say to current Scott, and would be to just keep going, take your time, don't rush it. The last thing you want is a re-rupture, and obviously you want to get back to all the physical fun things you used to do, but it takes time. So I guess that's at least that's pretty much the advice that I'd give to anyone now who's earlier in the journey than me, is just take your time. You'll get there. You'll get to this position where I can stand in front of the camera and deliver this and not be wobbling around and not be in pain. Where you'll get to the position where you can walk the day-to-day stuff. You can drive if you haven't been driving. You can stand to shower. You'll get there. Just keep going. It takes time. It takes a lot longer than I wish it had to, but it seems to be par for the course, at least with our current understanding and current medical technology. So it seems like balancing on the right is going pretty well. At least physio was saying that balancing on the right actually looks a little steadier than balancing on the left. I think at the time I agreed. Right now it feels roughly the same. Maybe the balance is a little better on the right. Okay, so the new exercise is, rather than balancing and swaying, is now to do single leg heel raise attempts. So doing the balance, feeling pretty stable with balancing, and if anything, the balancing without any swaying or anything has been feeling pretty good for a while. But single raise attempts, fingertips on the wall. Shouldn't be trying to use the wall to help myself up in any way, so hands against the wall, or grabbing onto anything's out of the question. But going for a raise, and there's nothing there. So at one point today, physio said, yeah, I could slide a piece of paper on the heel. Right now, it doesn't feel like that. I feel like I'm eating by throwing the body up, using other muscles to get some momentum. I'm pushing as hard as I can with the calf and getting nothing, or at least I'm not feeling like I'm getting anywhere. It's the tiniest amount, even with cheating. And so this is for 2 minutes, or at least accumulating 2 minutes. But it's meant to be heavy. Yeah. Alright. That's enough for me. Going for 90-10% body weight double leg calf raises, and trying to get a little bit more than 10% on the right. I feel like I can get 20 or 30% at the moment. Or maybe not. Feels quite weak. Yeah, going for second set. Feels like I can do more than 90-10 for sure. And final set of 3. Definitely feeling weak now. Oh, come on. Ah, goodness.
If you found this or my other videos helpful, I'd really appreciate it if you could drop a like or subscribe to the channel. That lets YouTube know that you like the content and it'll help get this information out there to other Achilles rehab patients. Thanks a lot, and I'll see you in the next video.